Cyclobenzaprine, brand names Amrix, Flexeril and Fexmid, is a muscle relaxer medication used to relieve skeletal muscle spasms and associated pain in acute musculoskeletal conditions. It is the best-studied drug for this application. It has also been used off-label for fibromyalgia treatment. A new bedtime formulation of cyclobenzaprine is under development for the management of fibromyalgia syndrome. Medical use: after sustaining an injury, muscle spasms may occur to stabilize the affected body part and prevent further damage. They also generate pain. Cyclobenzaprine is FDA approved to treat such muscle spasms associated with acute, painful musculoskeletal conditions. It decreases pain in the first 2 weeks, peaking in the first few days, but has no proven benefit after 2 weeks. Since no benefit is proven beyond that, therapy should not be continued long-term. It is not useful for spasticity due to neurologic conditions such as cerebral palsy. Cyclobenzaprine has also shown effectiveness in the treatment of fibromyalgia symptoms, with a report of 4.8 patients needing treatment for each patient reporting pain reduction. In elderly patients, cyclobenzaprine HCl may be started at a lower dose and titrated slowly upward. Cyclobenzaprine is recommended for use up to 3 weeks, but clinical efficacy has not been demonstrated beyond this point and long-term use of cyclobenzaprine is not recommended. Cyclobenzaprine, however, has not been documented to cause intense physical and psychological withdrawal symptoms following discontinuation such as those which occur with its benzodiazepine, barbiturate, and carbamate alternatives, although the potential for rebound plasticity is of clinical relevance. Side effects: meta-analysis studies have found significantly increased rates of drowsiness, dry mouth, dizziness, and adverse events of any kind in patients taking cyclobenzaprine versus placebo. Drowsiness and dry mouth appear to intensify with increasing dose. The sedative effects of cyclobenzaprine are likely due to its antagonistic effect on histamine, serotonin, and muscarinic receptors. Agitation is a common side effect observed especially in the elderly. In general, the NCQA recommends avoiding the use of cyclobenzaprine in the elderly because of the potential for more severe side effects. There is one case report of overdose causing rhabdomyolysis. Treatment protocols and support should follow the same as for any structurally related tricyclic, such as tricyclic antidepressants. Overdose: the most common effects of overdose are drowsiness and tachycardia. Rare but potentially critical complications are cardiac arrest, cardiac arrhythmias, severe hypertension, seizures, and neuroleptic malignant syndrome. Life-threatening overdose is rare, however, as the median lethal dose is approximately 338 mg per kilogram in mice and 425 mg per kilogram in rats. The potential harm is increased when central nervous system depressants and antidepressants are also used. Deliberate overdose often includes alcohol among other drugs. Interactions: cyclobenzaprine has major contraindications with monoaminoxidase inhibitors. At least one study also found increased risk of serotonin syndrome when cyclobenzaprine was taken with the serotonergic drugs duloxetine or phenelzine. The following substances may interact with cyclobenzaprine: alcohol, central nervous system depressants, tricyclic antidepressants may increase the chance of side effects. Monoaminoxidase inhibitors taken within 2 weeks of cyclobenzaprine may result in serious, life-threatening side effects. If co-administered with opioids, the dose of one or both medicines should be reduced accordingly. The patient should be monitored for excessive sedation. Comparison to other medications: cyclobenzaprine has been found to be non-inferior to tizanidine, orphenadrine, and carisoprodol in the treatment of acute lower back pain, although none have been proven to be effective for long-term use. No differences in pain or spasm scores were noted among these agents, nor when compared to benzodiazepines. However, known benzodiazepine treatment was found to have a lower risk of medication abuse and continuation of use against medical advice. Side effects such as sedation and ataxia are also less pronounced with known benzodiazepine antispasmodics. In a study on the treatment of musculoskeletal pain, treatment with cyclobenzaprine alone or in combination with ibuprofen, no significant differences in pain scores were noted among the 3 treatment groups. Peak benefit was found to occur on day 7 of the treatment for all groups. Synthesis: cyclobenzaprine, N-dimethyl-3, dibenzo, D, cycloheptane 5-iodine, propylamine, is synthesized by reacting 5-hours dibenzo, D, cycloheptane 5,1 with 3-dimethylaminopropilamine chloride and subsequent dehydration of the resulting carbonyl in acidic conditions into cyclobenzaprine. NB-cyclobenzaprine is made from dibenzo-subarenone starting material. Formulations: orally, cyclobenzaprine is marketed as Upus cyclobenzaprine, Flexeril, Fexmid and Novocycloprine. It is available in generic form. A once-a-day, extended-release formulation, Amrix, is available. Cyclobenzaprine is also used by compounding pharmacies in topical creams. Cyclobenzaprine is regulated in the U.S. for prescription use only. Though it does not fall within most governmental guidelines as a controlled substance, possession of it without a valid or current prescription may be illegal, depending upon various state and local laws. See also, amitriptyline, cyproheptadine, references.